How is everybody doing? And welcome back for another Strength Chat episode. Today, I'm joined by a very special guest. He's a doctor of physical therapy. He's got over 20 years' experience in high performance and general fitness as a coach. Today, I'm joined by the one and only Dr. Justin Farnsworth. How are you doing?
What's up, man? The one and only. I appreciate that. That was very nice of you.
No problem at all. I always think you'll get used to this. I do like a little bit of a tangent. I would love to be like a commentator or like a ring announcer and just be like, the one and only. And then you walk out to it, and then that's what you can have every time when you walk into a seminar or a session or anything like that. But
That
um
would be awesome.
I'll clip this up for you. I'll send it over for you. You'll be all good with that. But yeah, appreciate you taking the time to jump on. Suppose the first question is, yeah, how are you? What's kind of been happening in your world recently?
And I'll be honest, man. I'm great because the U.S. just won last night. Horrible
Yeah,
red
yeah.
card. Horrible red card. I used to play professional soccer. I played through college. Like that is the worst red card I've ever seen. But that's fine. I'm also super biased, so I'm great, man. I'm great. Like life is good.
Yeah. Have you been following much of the World Cup? Because I'll be honest,
Oh yeah.
some of the kickoff times here have been like really early hours of the morning. So I've only been seeing results rather than actual games. But yeah, being able to follow along.
Yeah, oh yeah. Yeah, yeah. I mean it's in the US. We'll watch it live. We didn't end up going, but we're about 2.5 hours from Toronto, Canada. We're right
Ah,
across the
okay.
lake in Rochester.
Yeah.
So I considered like getting some tickets and driving just across the lake to go watch a game. We didn't end up doing it because I like my couch better and it's cheaper. Um, but no, man, it's been fun. It's hosting the World Cup is a cool thing, and the culture. I know this is not what this podcast is about, but the culture of soccer being brought to a country that does not appreciate soccer for lots of reasons, because we have lots of other sports and our athletes go play basketball and football, whatever. But as someone that's played it for a very long time and it enjoys it, it's been super cool to see like everyone's a soccer fan right now. And what I'm hoping happens is what happens like after it was the 2022 World Cup, like when Landon Donovan, Clint Dempsey, we, you know, went the farthest we've ever gone, and then you see soccer like kind of exploded a little bit and like kind of stayed there. And so I'm hoping this does is it can kind of just take it like to that next level of
Yeah.
where you gain a little bit more interest. And maybe the next 8 to 12 years we can go and actually beat European teams and not just get freaking embarrassed half the time. We'll
Yeah,
see.
yeah. Yeah, no, I think I've been listening, I've been following along, listening to a couple of clips and that sort of stuff. And I think everyone has kind of, whether it's people traveling over to America or actual Americans being like, all right, the World Cup's on, and there seems to be a good buzz around it, which is good. And I've actually always said, so I'm more rugby than I am football, but in
Mhm.
terms of just the sheer size. Again, we're going on a tangent, but I like it. The sheer size of America in terms of how many kind of like athletes you could tap into, whether it be rugby or football. It could be a force to be reckoned with if it keeps building and building and building.
It's true, man. America is a big place. It's like if I bet I live on Instagram. That's like half of what I do. I'm probably there too much. I get the alarms every day, like put your phone down. But if you look at like what are a lot of the people that are whether they're real or fake people, they're like, I never realized America was so big. And it's like, yeah, this is why you have a lot of Americans that never leave America. Like maybe they should. It would probably be a good idea to get a little cultured, but it's like from Maine to California, like you get everything you need in the freaking country that's huge. It's just why it's a cool spot, man. Obviously I'm American, so I love it here, but and I got
Yeah.
the thing on. So the World Cup's over, but yeah, man, it's been cool to watch, honestly.
Cool. Well, I know I did quite a brief introduction at the start. Obviously, you've mentioned there about yourself, playing football to a good standard. For everyone listening who might not know your background in education, competing, coaching, just want to give a little bit of a background to yourself, Justin.
Yeah, I'd love to. Yeah, the 5 minutes Cliff Notes version. So I always tell people when I go and I teach in person, like I'm 38 years old. I've been coaching since I was about 12 to 13. So here in Western New York, we're very good at hockey and lacrosse. My first job started at a facility my high school soccer coach owned. So it wasn't because I was good. It's just like I knew the guy that owned it. He asked me to come work there. And I'm like, that sounds great. And it was in the basement of a hockey facility here in Rochester. We had like four rinks, and then we had this kind of like ugly-ish space for a gym. No windows, like dark lights. And we used to do first day I walked in, we had the most of the entire Buffalo Sabres roster that was on the deck. We had this really cool ice skating treadmill, one of the first of its kind back, 20 years ago. Um, and that's what we did. So like actually I started high level sports performance. We did all the high level Western New York teams, people in and out, and I did that through high school. So I trained there as an athlete and I just worked there. So I used to do like athlete group fitness, one-on-ones. Like we did all that stuff. And then from there went played soccer in college, prior level, was pretty good at it, and then got a little burnt out and decided to move on and do something else. And at the time, there's a new thing that came out called the Doctor of Physical Therapy, the DPT. And like, it sounds really cool because people have to call me doctor, but I don't have to take organic chemistry. Like that was one reason I didn't go to med school. It was like I don't want to take OChem. So did that, got that from Upstate Medical in Syracuse. And then my wife and I, we moved around a little bit. So we did Arizona, kind of did what you did with the Thailand thing, where it's like, we're just going to do this and
Yeah.
see what happens. So lived in Arizona for 4 or 5 years, New York City for a few years, and now we're back in Rochester. So I had a clinical career that's lasted about 13 years. Just a lot of time, right place, right time, right people, worked very hard, saw a lot of the rehab population that our PTs want to see, young, athletic, post-surgical, like, but that was a lot of work and relationships that were built into doing that. And then since 2020, I had an opportunity to go teach courses, taught in-person education inside the fitness industry more than anyone since 2020, 3 times a month on average. I did the math. It's like 215 plus courses, about 6 to 7 thousand coaches that I've taught. And since 2024, I now manage it all and run it all myself. So I do two main things. I teach a course called Programming Around Pain. It's to help coaches think more clinically. That's really what it does. It's not to help you diagnose pain, but it's to help you understand 90% of your clients. If you look at the fitness industry, people aren't coming to see a coach who are 23 years old and have nothing wrong with them. Like when I was 23, I was just going to the freaking gym. I'd buy a PDF program. I'd put my own together. Like that's what 23-year-olds do. Who are you seeing? You're seeing the 40-year-old mom of two that has a job, husband has a job, and like their knees kind of cranky. They were told to never deadlift because it's bad for their back, and they hurt their back one time lifting a laundry basket. Like that's what the course is built around, how to use exercise as medicine and empower the people that you work with and realize pain is not scary. It's complex, of course, but helping to simplify that for coaches and still make training the training. You're not going to bird dog people out of their chronic back pain. Sorry, it's not going to happen, right? We need higher dose solutions for those problems. I do that. I actually have a course I teach physical therapists. So I have a couple contracts with physical therapy companies, and that course is called Rehab Rebuilt. And that's to teach clinicians how to be like a coach. It's to do the inverse. It's like, what do clinicians not get in school? And I know because I'm one of them. No one ever taught me how to squat or to teach a deadlift. Like it doesn't get taught in clinical education. I know that from what I did right, as a coach. And then I run an online personal training business. I work with coaches predominantly. I do custom programming design, education, high touch point. So that kind of blends all together into what my current kind of business is and what I do now every day.
Nice. And with that, you know, you've said there you've kind of, from, teaching the coaches, think a little bit like therapists and vice versa, if you like. Was that kind of always the plan, because you've kind of got a foot in both camps, or did it kind of come naturally? Did opportunities just come up to be able to do that? How did that kind of come around? Because I think sometimes it's a case of um it's interesting seeing that blend, of being like you can see it from both sides, which, excuse me, I don't think maybe a lot of people can. So was that always kind of the goal, or how did that come about?
No, man, it just kind of happened. So like, I'll tell you, like my clinical career, like I did all this stuff. Like I was a strength coach first. Um, I went to PT school. I got board certified in sports. I did all the PT stuff. And then I used to get not made fun of, but I'd always have colleagues that would look at me like a weird way because I had people up like goblet squatting off the table. And like that's just always how I've treated patients. Like I know the local stuff. I know how to do manual therapy. I think that's important, but I would spend most of my sessions making people work out, like even though their knee hurt. And my patients did very, very well. It wasn't like they got worse. They actually got better quickly and they really liked coming to therapy and they didn't cancel. And I started to kind of realize, like, I learned all this stuff from PT school, whatever, that's fine. That's a pass a licensing exam. But like this blend of like what a strength coach does and what a good PT does, like this idea of bridging the gap has always been interesting to me because I don't think anyone even knows what it means. I think it sounds really sexy, but I don't think anyone actually knows what that means. And what I came to mean for me was like actually using like actual strength and conditioning principles inside of what a rehab setting looks like. Like older adults need power. They should be able to jump. Laying on your side doing sideline external rotation is fine, but it's not a high load solution. It's like a local accessory solution. So thinking about how we used to program for our athletes and pulling in the best of the clinical world and putting those together. And then I'll be honest, man, everything that's happened to me, I think has been accumulation of like it's a lot of hard work. I've said yes to a lot of stuff that I did for free. I put myself in a lot of uncomfortable positions of stuff I've never done before to try to just like take the next career rung on the ladder. And basically, what brought my opportunity for teaching was COVID.
Yeah.
So, COVID hit, shuts the whole freaking world down. Um, Long story short, we had my father-in-law got diagnosed with cancer terminally. My daughter was just born, and COVID shut the clinics down that we used to operate. And like all that happened within about 4 months of each other.
Wow.
And I got an opportunity to go teach for a company. Um, and I hopped on it. So I hopped out of I actually taught, I would teach every weekend. I know I'm getting long here, but what I used to do, daughter was born. She was about 6 months old. I got my first teaching opportunity. So I used to see patients Monday to Friday about noon, about 80 of them. And then I would get on a plane. I'd fly to a city. I would teach a 2-day, 16-hour course. I'd wake up early as hell Monday morning. I would fly back to New York. I would go right to urgent care and I'd get my nose swabbed because it was COVID and medical providers in New York were supposed to go get COVID checks when you left the state. So I did that for a bit. And then I'd go right back to the fucking office.
No
And
way.
I did that for a year. And I had a lot of caffeine, a lot. That's when I discovered rain. Um, I did that for a year. So managing an office, treating full time, being one of the most productive PTs with a minimal cancel rate inside of the company I'm working for, teaching 16-hour courses. And then eventually that 16-hour course opportunity became a full-time job for about 5 years. And so it allowed me to kind of transition into what I'm doing now. And it was really all just, it's always a right place, right time, right people. Put your head down, work hard. Like I think a lot of this stuff does work, but sometimes you just like you're in the right place at the right time.
Yeah, I completely get that. I think I like to ask that question about, how, was that always the plan or how does it come about? And, like what you say there, opportunities coming up because I think sometimes, so basically my last role back in the UK was head of personal training. So I would help with coach development for the coaches and trainers that were part of the gym. So it was across two gyms. And sometimes it would be a case of, look, let's just keep doing this, see what opportunities come up, similar to myself over here. Dotting around quite a lot of gyms, speaking to people, and then an opportunity came up to, work at Titan. So I often find that quite interesting to ask. But going back to what you mentioned and kind of diving into the first topic or question that I had in mind was, getting people off the table and then doing goblet squats. And you've said there about having it as um learning from what would be a good PT, what would be a good strength coach, and sometimes there, and I've had this with from my own experience from speaking with clients, speaking with other coaches. Um, Sometimes movement can be like overcomplicated, or sometimes the tools used make it very challenging for like what you said there, somebody in a mum in their 40s who just basically wants to, not be in pain anymore or just learn how to move, get a little bit fitter, get a little bit stronger. Whereas sometimes it's made too complicated that it kind of like doing a squat, doing a hinge feels so alien. And I would like to hear kind of your thoughts on, do you agree with that? How do you kind of make movement not as complex or just easier to click with kind of the general population when they've got one of the examples that I put down was you put a post up about like the wooden dowel down the back, and it's kind of like I've done that with people and people kind of do it, and they're like, what is he's like it never goes well. So yeah, if that kind of makes sense, just want to kind of hear your thoughts on that.
And for the record, I've used the dowel for a decade.
Yeah,
Like there's a lot of stuff I put on Instagram. And I'm like, it's funny. I look like I'm not that old. Like I've been actually coaching for a long, long time. There's a lot of stuff I used to do that I don't do anymore. Back when I did it, I'm like, this is the best thing. And then
yeah,
10 years later, you're like, it actually wasn't. Because what you know now is not what's going to be true in 10 years. That's just like how the
absolutely.
field works. Um, Look, man, I think there's a couple things. I think on the fitness industry end, the barrier of entry is so low that we overcomplicate things because we just don't know.
Yeah,
Honestly, the education, and that's what it is, right? On the rehab end, the barrier of entry is a doctoral degree that we really probably don't need. Like, if I'm being completely honest, the whole APTA Vision 2020 never came to fruition, so we all overpay for a doctoral degree that we probably, to be honest, didn't need. So you have a group that probably isn't educated enough, and then you have a group that is overeducated, underpaid, underappreciated. And then like there's this in the middle where it's like people have a hard time how to connect to those two principles. Um, I'll make it easy. Whenever I think about working with someone, I think about human movement. I think about number one, how do we categorize movement? Easy. You put them into the same categories we've been all preaching for the last 50 years. We squat, we hinge, we lunge, we push, we pull, we carry. Awesome. Sometimes we rotate. Sometimes the push goes that way instead of that way. Great. Categorize that first. Then find an entry point. When it comes to entry points on exercise, what's the easiest way to teach someone an entry point exercise? It's going to be a low center of mass, a tool that doesn't have a lot of lever to it, like a kettlebell is way easier to teach a thing than a barbell. And then it has lots of points of contact. Like when you just think about those are principles, right? And as soon as you can think about principles, knowing what to do and how to coach it, I think becomes a lot easier. I think what happens a lot of times in the industry is people want to be told what to do. They don't want to be told how to think. But if you know how to think and you can organize, you can work with anybody.
yeah,
But as soon as you're always like, I only squat that way, I only squat that way, there's a lot of people you simply can't help. So, we can use something like a squat as an example. Every single coach, every single clinician, I would hope, if we're giving people an entry point to a squat, it probably looks like a goblet squat, give or take. Yeah, there are some people, the squat is literally, hey, my doctor said I can't. So then you're like, that's fine. You know what? Just sit in the chair, stand up, sit back down. Great, do that 10 times. Awesome. Now they're squatting without knowing they're squatting. We call it a sit to stand. Um, but it's like, why does the goblet squat work so well to teach a squat for people? Well, you have a load that's within your center of mass, so there's not a lot of stability requirement required from you relative to like a barbell, right? Where the load is placed corrects around all the things that go wrong in a squat. People lose their squats forward. Well, if I have weight in front, I'm probably going to slam my face into the ground. Okay. People have a hard time bracing on a squat. Well, when I hold load in front of me, not on my chest, that's where people go wrong, slightly off my chest. What does that force you to do? You reflexively have to brace. It's also in front, so it keeps your trunk upright because it helps shift your hips backwards. So all of a sudden, the position becomes the corrective, right? And how I coach it becomes the corrective versus balloon breathing, 99 shin boxes, rolling around on the ground, all stuff I used to do, like low load stuff to try to solve a high load problem. When
yeah,
it's like, no, the squat is the thing you're going to do to fix the squat. And sometimes people turn their toes open because that's how their hips structured, not
yeah,
because their ankle's tight. Like that's just how I've simplified it, and I think it's just finding like what's the easy position. So the goblet squat's a great place for the squat. The dumbbell RDL or the kettlebell good morning, as an example, is a great entry point for the hinge. And if their hamstrings are tight, kneel them. Take the hammy out, put it in a kneeling position, and like teach the pattern. Like the push, a push up, an elevated push up. Like everyone can kind of access that to some point, right? The A pull pattern, like a TRX row, is a really easy entry point. These are things that in rehab, people that have pain, it's like these are the entry points for a lot of people. We can start here. Now you have a foundation that's stable, low center of mass, minimal to no load, and you can learn movement skill. And once you can learn movement skill, we can now layer in load, right? The last thing we want to do is have people we work with be like a cannon being shot off of a canoe. I don't
yeah,
want that. I want something that's easy to coach, easy to teach, easy to learn, easy to brace. And once you can own that, now we can layer on load on top of that. So I know that's like very kind of up in the clouds ish, but that's how I've always thought about those aspects of like where and how to start people. And then you take it a layer deeper and be like, well, what if they have a thing that hurts? Like that's where knowing how to move them around to overload or underload certain symptomatic tissues also matters. Like a knee that hurts going over the toe, we're going to box squat with a goblet first because your hips are going to have to go backwards. We're not going to expose the thing that hurts, right? Someone with low back pain, we're going to heal, and maybe that low back pain is flexion bias, so they don't want to go deep on a squat. We're going to elevate their heels. I'm going to give them a box to tap to, and we're going to put weight in front and the trunk's going to be upright because now we're keeping them out of the symptomatic spot, right? So it's like layering in that second aspect of positioning, teaching, but also what tissues do I want to overload and underload versus what's painful and symptomatic. And you just put all of that together and then you pick exercise. And then you do this amazing thing called progressive overload, which works every single freaking time. People just get
Yeah.
bored. They have exercise ADHD. 2 weeks in, they want to do something new. And I'm like, it makes no sense. It doesn't make any sense. We need time with those patterns.
Yeah, absolutely. I was nodding along as you're saying there because the thing that stuck out there is you say, it's a system to follow, it's principles to follow, rather than kind of, well, what was making me think there is when you were saying about, the a lot of groundwork, do you think that actually maybe from a coach's point of view or a theoretical physical therapist point of view, they try and regress it too much because when you've said there about somebody, look, they want to get better at the squat, they've got pain discomfort in the squat, whereas that's what's actually going to get them better doing that. There's often sometimes a fear of, oh no, we can't make them squat because they've said it hurts when they squat. And there's also, this might be a different rabbit hole to go down, that client is paying them to be like, I want to do, I want to get out of pain, but actually sometimes it needs to be, that movement still needs to be disguised somehow, like what you said, doing a sit to stand. Does that kind of make sense in terms of maybe people are regressing it too much or regressing the wrong things?
Yeah, so that's how I think about it, right? It's like if your client walked into your building, they can probably stand and exercise just naturally. Now, here's what you'll do. You'll talk to the people. It's interesting. Everyone's way they think about things is shaped by what they see. So if you talk to someone who only works with people that have chronic debilitating pain, they'll be like, no, no, I can't squat any of my people. That's stupid. It hurts them. I can't even get them out of a chair. Well, of course you're going to think that because that's what you see, right? And that's actually true for some of those people. And that chronic pain is a different thing to talk about. That we're going to
Yeah,
put that over here for right now because that's more than just the physical. But generally, how I've thought about it, if they walked in, they can probably stand and exercise. If you can't find, and the reason why, think about weight bearing versus non-weight bearing exercise. What changes? How the muscles operate changes. The range of motion you move through closed chain, open chain is completely different, right? So if you work your quad in open chain, it's going to extend your knee, but functionally it decelerates your knee when your foot's on the ground. So how it operates is literally different. When you're standing, you get more compound ability. Like talk to anyone. What's going to make bigger change on getting you stronger? Isolated exercise or compound exercise? You can do both, right? A muscle in isolation that's stronger is still a stronger muscle. That matters. And sometimes we're going to bring up weak links, but weight bearing is going to give you more compound. It's going to have a better hormonal response, better loading capacity. Like I'm speaking basics of 101 exercise that we
yeah,
all agree to. We just started arguing about because you get gurus on Instagram that haven't worked with anyone that just try to like sell their system. Um, Past that, it's also just like understanding proprioception. That matters. Like when you're non-weight bearing, there's no proprioceptive feedback. When your foot is on the ground, you're getting proprioceptive feedback from your foot, from your toe, from your ankle. Like all that kind of matters, right? So that's how I've also kind of thought about it. Now, look at you might have someone who can't squat because their quad is so freaking weak because they had knee surgery last week. Well, of course, I'm not going to squat them today. We are going to put them on the table. We are going to do isolated exercise and try to bring up the weak links. But at some point, my job is to transfer the weak links into a compound pattern,
yeah,
if that makes sense. So that's how,
yeah,
again, that's how I've always thought about it. But like outside of post-surgical precautions, there is no one that walks in and I'm like, I can't make you stand and do stuff today.
yeah,
Even the chronic pain people. Chronic pain sucks. Like I've never had chronic pain like that. I can't imagine what that would be like. But those are even people where I don't even ask them how much pain they're in because it now focuses on their pain. It's like, and I tell them that I'm like, we're gonna work. and just trust me. But it's the communication, the education, the relationship building that goes in there first, and then they kind of buy in a little bit. Um, so I think I answered your question, but that's just like, and we're very up in the clouds on how I think about this stuff. But I like these higher level conversations because it's just when you know how to think, I think it helps you help a lot more people.
Yeah, absolutely. I think what you're saying there again, I'm nodding along, seeing what I like how you were speaking there is that it's a process. What then leads to the next step? What then leads to this? Because I always think it's kind of how my brain works is like a little bit of a flow chart. Okay, we're going to do this. Right? Does that allow us then to do this? Can we then do that? Do we need to stay around here a little bit more and then go from there? And one thing, you kind of mentioned it at the start about being told what to do or being shown how to progress. And I think probably a better way of saying that is people having a little bit more independence of it rather than kind of just saying, look, just fix me, just do this, as opposed to no, it's a learning process of, like what you're saying there, the client understanding what they're doing. What does that feel like? What does this progress from there? And one thing that you said, having that buy-in, do you think by, the method that you've said there, look, you've been able to walk in, right, we're gonna do this, we're gonna work through that, as opposed to the groundwork that we mentioned before. Do you think that actually allows them to uh progress more, increase their confidence, and also be more willing to kind of push a little bit more, if that makes sense, rather than sometimes with pain, there can be a case of, oh no, I'm not going to do that. Like I will do anything else apart from this. Whereas actually, it's going back to like what you said about the squat. That's the thing that you actually need to do rather than trying to do a load of other stuff, which, yeah, it might help, but you kind of just skirting around the problem, if that makes sense.
Yeah, I mean, look at getting that person to buy in is always the hardest part. Look at I have found the longer I got into my career treating patients, the first visit, I'd actually do a lot less stuff and we do a lot more talking,
Yeah,
depending on who that person. Some people come in like post-op ACL day one, they know what they need to do. That's easy, right? But there's still the education and showing them the steps and it's telling them why. And it's not over educating, but it's like, hey, you've had chronic pain for 30 years, you've had 10 surgeries, you're on 10 meds. Um, like, what do you want the next 20, 30 years of your life to look like? Do you want to be able to get off the floor, live independently, play with your grandkids, be available in society? And if you do, our focus can't just be on how you feel. It has to also be on how you are.
yeah,
Because like you can be pain free and still unable to get off the floor.
yeah,
Right. You can have 10 out of 10 pain and be able to get off the floor. So this idea of pain and function don't always like overlap a ton. And it's not as easy as get stronger, your pain will go away. That's dumb. That's not how it happens. We know things, we have risk factors. Certain areas when they eventually get weak can maybe overload a joint and then the joint becomes painful. But these are leaps that we all make with pain. And the more we realize about pain, we realize we don't know much of anything.
yeah,
But I think for your look at your general human. We are fatter, more depressed, more unhealthy than we've ever been, ever. And you look at the US and you look at how much money we spend on healthcare. I believe the last stat I looked at what we waste, not what we spend, we waste $1.2 trillion. That's a T.
wow.
It'd be kind of nice. I'd love to have an extra trillion just chilling in my bank account. It's like we waste that. Um, and we spend more money than the next 30 to 40 countries combined on our healthcare. And we waste more money than a country's entire GDP. We burn it, throw it in the freaking garbage. So it's like the more we know, the more we medicate, and the less we move, it still hasn't solved the problem. Like the more we spend still hasn't solved the problem.
Yeah,
So I think for most people, like I truly believe movement is medicine. Look at the biggest predictors of you and I dying. Honestly, like they're how strong you are, what your VO2 max is. And I don't mean strength, like put a barbell on your back and you have to squat 800 pounds, because I think at some point, strong enough is strong enough. Like
yeah,
ask every athlete, coach who works at, like, how strong is strong enough? No one really knows the answer, but like you should probably be able to squat 2 times your body weight, roughly. You should be able to bench press 1 and 1.5 times, like sport and gender specific, but it's like you get strong enough and then you work on other physical properties. Get fast, be mobile, walk more than you used to. And then that's the hardest part is going from nothing to something. Right? Getting fit is the hardest part. But once you're fit, it's really easy to maintain. right? If you never lose it, you never have to get it back. And I think it's just when you're having those conversations with people, it's not easy. I've had a lot of them, had a lot of them for a long time. There are some people that just they don't want to buy in. And sometimes I think, was that my fault? Did I not educate and tell them enough? But some people just, it's like telling a smoker not to smoke. And they're just like, I know. And they do it anyway, right? So, like, at some point, the person in front of you has to take ownership of their health. But it's my job to provide you the context and the education. And ultimately, it's your decision to make. It's
Yeah,
not my decision to make for you. I want to make sure you're making a decision that's informed with all the data behind
yeah.
it.
I thought that was interesting. I didn't actually know that in terms of how much money wasted when it comes to kind of health and fitness. And I'm a big believer in the phrase that you sent there. You know, movement is medicine. You know that does help, but still, you know the stats there, the amount of money wasted. Why do you think then? You know um, that it gets spoken about movement is medicine, you know, that you know you don't need to rest all the time, you know, by working through these movements, kind of like normalizing pain as well. Why do you think that rest is, yep, just don't do that exercise, yep, just rest, just don't do anything for 4 weeks? Why is that still kind of the go-to prescription as opposed to, you know, it's a case of, well, no, actually, like what you said, you've walked in, let's try and do things a little bit more. Is that, you know, a fear of injuring the person further? Is it a lack of knowledge? Is it an easy way out? What's kind of the better option?
I'm gonna get in trouble for this. Um, I don't know, man. Sometimes people are just dumb. Like I mean, no, I mean, look at this, right? So if you look at the way that Western society and medicine tends to work, okay, for the longest time, we have spoken that pain equals harm. Period. Every time you feel something, something's broken, right? I mean, it wasn't that long ago that bed rest was the medical intervention for back pain.
Right.
And then like we're not that far removed from those things, right? I think some of the challenges is you have an overemphasis, and I don't mean this in a bad way, because people see me on Instagram, and on Instagram you have to be loud. Like if you want anyone to read anything you're saying, you have to be loud. You can't just be like, "Here's the nuance." No one's going to read that shit. In fact, we know this. You'll get better engagement if you actually do something. Like if you say something that makes people angry, your engagement will go up. So it's this stupid game we all have to play. But I think if we're just being real, we look at like general practitioners, your GPs. Right. People who I know for a fact are recommending exercise. I know that every time someone comes in to their doctor who's overweight, who smokes, they're like, you shouldn't smoke and you should probably exercise. When you look at the medical healthcare system in the US right now, your general practitioners aren't seeing 10 people a day, man. They're seeing like 50. Okay. Imagine having a 5-minute office visit with your doctor and having all these questions and problems, and they not only don't have the time to answer them, they actually don't have the education to answer them.
Yeah.
Talk to your GP, orthopedic. Most of them don't actually train, by the way. They might go to like a hit class and like ride their Peloton, but you and I work like there's working out and there's training.
Yeah.
Those are two very different things. I'm not saying one's better than the other, but like we train, right? Most of them don't have their own physical practice that's consistent. None of them have the background in med school. Like no one gives them exercise education in med school. It might be a day, right? And then what you do is you have all these people you got to see every day, and you're like, you need to exercise, but it's like telling someone don't go to McDonald's. Like they already know. They already know. No one drives through McDonald's and goes, "This is really good for my health." No one finishes a handle of vodka and goes, "Man, this is going to help me live longer." So I think humans innately know what they should do. They have a horrible time taking action on it and knowing the first step. So if I tell you just to exercise and I give you an app or a handout, um, how is that going to move the needle? Like this is why AI will never replace coaches because coaching is about relationship more than it's about anything freaking else. It's easy to get someone strong. It honestly is. It's not that hard. What's harder is keeping the relationship, getting them to trust you. But once they've got that buy-in, man, you'll have people like that'll work with you for life because that's the more important thing. Like people want to know they have a friend, a guide, someone that cares about them, can help them through the journey that maybe you've been through yourself. But I think you look at Western medicine, like you have overworked medical people You have a over reliance on pharmacological drugs, and look at that all starts at the top. That's just like the reality of how what gets pushed. Um, you have, people say, gyms are too expensive. There's no access. I'm like, look at me outside doing some push-ups, body weight. Like you don't have to spend a ton of money and go to the gym to get like fit and healthy. Like it's not, it doesn't have to be exclusive and elitist. I think a lot of people don't know what to do. And some people that start exercising do too much too soon, too often after too little for too long. And they're like, no, running is bad for my knees because I started running and I just did 10 miles yesterday after never moving ever. And now my knees hurt. Like we don't create general preparedness. Um, there, and then we have the general over reliance on images, right? I mean, and again, look at it's tough because I've been in medicine. If I'm a doctor and I have a patient come to me and they have back pain and they're demanding I give them an MRI, and I'm like, look at the MRI is actually going to make you worse. We know for a fact if you have chronic back pain or you have, sorry, acute back pain and you don't have any red flags and you go to the doctor in the first 4 to 6 weeks and they give you an image, your cost to our medical system goes up $12,000 per case and you're more disabled at 1 year. Right. Now, I could tell Steven that. I could tell you that coming into my office, having just hurt your back yesterday with no red flags. And if you want an MRI and you demand it, at some point, somewhere along the way is going to give you an MRI. Someone's going to do it just to shut you up. And then MRI is going to show stuff. It's going to show, I mean, I'm not sure how old you are. I'm 38. So 52% of people in my age category have disc degeneration MRIs and have no back pain. It's going to show that. And the radiologists are now starting to put in, it shows this and this is a normal finding. But all of a sudden you like become defined by, I'm not the normal finding, I'm the abnormal one. This is why my back hurts. And then that creates a little bit of fear on how to move. And then you read about how deadlifts are bad for your back and you shouldn't forward bend and flex your spine. And like you put all that together and you start to kind of see there's never just one reason why we have a movement epidemic.
Yeah,
There's, I think, all these things that get snuck in. And then you throw having pain on top of that.
yeah,
Um, and like, look at it's not easy. I've had a bunch of things. I mean, I've gotten hurt pretty significantly before. And look at you got two options. You either don't move and you get less fit, or you find a way to move and you probably bounce back faster and you keep your cup of resiliency larger. And then you're the 80-year-old playing with your grandkids instead of the 50-year-old sitting on the porch wishing you could play with your grandkids. And I'm like, which one would you rather choose? So as soon as we frame around pain being a normal part of the human experience, I'm not talking getting your fucking leg fractured by a car because you got hit by a car. That is harm. I'm talking about the chronic stuff of what 80% most people deal with. As soon as we start to realize like movement is almost always the answer, and reframing expectations becomes a huge deal. So again, I know I just TED talked for like a good 5 minutes, but that's just I get so lit up about this stuff because I think that's generally like that's how you're going to help people. Like understanding all those aspects, I think becomes huge. And the answer, it always boils down to one thing: move your body. Like
yeah,
move your body, aim to get stronger, um, sleep
yeah.
enough, drink water. Like life will be okay.
Absolutely. I think a lot of things, again, I was nodding with everything that you've said there because one thing that stuck out that you said there just at the end was, find a way to move, find, that phrase of rather than saying you can't do this, let's focus on what you can do rather than, getting to a point where, yeah, you can't play with your grandkids, be able to do this or be able to do that. And, we are in an age of, and, I feel like I say this quite a lot is we're in the age of quite a lot of information and what you said there about having the image, I think sometimes because there is so much information and people want to be categorized as this or this or have a diagnosis of this or this, if you go looking for it, something will come up. What was funny, I actually had a conversation at the start of this week, a guy that had come over to the fitness camp, and he basically had a list of everything, and he had like scans, photographs, and everything, and was like, "Yeah, basically, I've been told that I can't do this and this." And why I was kind of nodding and laughing when you said, "Can if they've walked in?" I kind of just made a joke of like, how have you not kind of like fallen over? Like, how are you still standing? And it was just a case of, and that's why I said about asked about getting by and improving someone's confidence because if you've got, it's never just a case of like yeah, you'll be fine. Like, let's just do this. It's a case of this X, Y, and Z leads to this, and it's degeneration, and it's this and this. And then all of a sudden, you've got people that are coming in that are really scared, have no idea what this means, but all they have is a list of things that, could potentially go wrong, what could potentially hurt them. Whereas actually, there's never. I know what you're saying about, getting hit by a car, breaking your leg or anything like that, but I always think for the majority of people, yes, there are outliers. It's never as sinister as what is kind of portrayed to them. There's still something that you can do. Would you kind of agree with that?
Oh, dude, if I don't scare you into needing the surgery and the injection, then how am I going to give you the surgery and the injection? I mean, 100%, right? I've had those people. Look at, and I'm not here to say it's not a challenge, but when I've had people come in and like, it's got this laundry list of stuff, and they're like, what am I supposed to do? And I take it, I crumple it into a little ball, and I go, Kobe, and I throw it in the garbage. And I'm like, look at, I get all this stuff matters. This is your story, and I think that matters. But like, what are the options? There's an
Yeah,
amazing Lane Norton quote. I actually put it on a slide at the end of my course. And it goes like this. It's like, when you get older, you will have pain. You can be weak and in pain. You can be strong and in pain. That is your choice. I'm like, that's kind of how it is. Then you have the people like, no, 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 don't exercise is bad. I guess probably office workers are probably the most pain-free because they don't ever exercise and move around. Like, no, it's the safest job there is. That's how I just kind of categorize it. Yeah, pain is multifactorial, pain is complex. People get told lots of information. And again, I think that's sometimes based on the education system. Like Western medicine is still heavily inside of pain, damage, harm, image, medicate, even though as a whole, I still think we all know exercise is still the best supported intervention for just about like everything.
yeah,
But I get it. Like try telling someone who's massively depressed and can't even move that they should go to the gym.
yeah,
It's not like it's hard. It's not happening, right? So we understand that. It's just there is no other better thing than just like moving your body. Because what's
yeah.
the other option? There is not another option,
Yeah.
you know?
Yeah, I think from there, you said a couple of times there, what's the option? What's the option? And again, when I'm speaking with clients, there is always a choice. Like you actually have that decision to even, if you're basing it on the example that just comes to mind because I had a conversation about it today was like food. Like you actually have a choice
Mhm.
of like what you want to eat. Like, when you were going back to when you said about McDonald's or like the vodka that people are drinking, like, don't get me wrong, like especially me going back to the UK, I would absolutely love a pint of Guinness. Like I've not had a good pint of Guinness for a while. That's a choice. I might have diverted a little bit there, but when it comes to like movement, I think sometimes, and again, it would be interesting to hear your thoughts on this. Sometimes maybe people feel that they only have this one option, like they can only just be in pain and suffer and not progress from it, rather than actually it kind of takes to get out of that comfort zone or get out of that bubble to be like, no, look, it's either stay like this and be limited in what you can do, or actually focus on what you can do. So yeah, I do believe, that there is always a choice. It's maybe just finding that support to be able to choose the right choice, if that makes sense.
Yeah, it does. I think it's when you reframe it for people and try to give them that bigger picture view, I think the answer becomes obvious. And it's like it's helping them in a very backwards way make what you know is the right decision for their health, even though it's their decision to make. So it's like that's why I've always reframed, stuff. Another example of this is like I work with patients all the time, and I would get the question all the time, "Hey, should I get surgery? I was told I need surgery on this thing." I would say, well, I can't answer that for you. It's your decision. But here's what I would ask. If I were you, I'd ask myself this. If how I am today is the best I'm going to feel for the rest of my life, would that be fine with me? And if the answer is yes, then don't get surgery. But if how you feel today isn't good enough, then maybe consider it, but just realize like surgery isn't guaranteed. It's trauma. There's still a recovery that has to happen, right? And then also, have you put in enough time pre-surgery that you're satisfied with your effort that you don't feel like surgery is just giving up. And I'm never anti-surgery. It's just it's for the minority. And I'm not talking about, again, we have to classify this stuff. I'm not talking about getting hit by a car and having a compound fracture of your leg that actually should probably get surgery. We're talking about the chronic stuff, the degenerative meniscal tears, degenerative disc issues, degenerative rotator cuff tears. The research actually tells us you get surgery, it makes those things worse, and people do worse long term, or they do no better than not getting surgery or getting fake surgery, where they literally put people under, give them a little incision, sew them up, and people thought they got surgery. So it's like that's how I've kind of always thought about health and wellness is the same, is just I think it's helping people. I think it's asking the right questions, being very non-judgmental. Because I know how I feel. I'm just like, yo, everyone just go freaking squat, get stronger. Like that's the answer. That's how I feel personally. I know it's not always the answer, but being able to put people in a position where they feel comfortable enough, you can ask them questions where they can come to self-actualization of what they actually need to do. And
Yeah,
then, we could talk about this, like the gym isn't the answer to all pain either. Like 80% of chronic disease is your lifestyle.
yeah,
We know this. It had nothing to do with whether you barbell back squatted or goblet squatted. You should probably move. Like movement is inside of your like daily activity and lifestyle, but there's also all the other stuff like sleep, eat, stress. Sometimes you got to pick your parents wisely. Like it's hard to do. I get that. Smoking, drinking, like all those things, right? We know go inside.
yeah, yeah. It's interesting, and everything that you've said there. Again, I find myself nodding along, and a lot of this information is. I can imagine, or I would hope everyone listening is kind of nodding along again and realizing, yeah, yeah, that does make sense. And by having conversations like this, because you touched on it before, with um social media being controversial, getting a reaction. Obviously, there's going to be more interest in there, and if it sounds as though, oh yeah, that must be what I've got, whereas actually, again, speaking generally for the majority of people, it doesn't take a lot, or it won't take a lot to be able to see some benefit. The common theme that we've said throughout this is, movement and meeting it where you're at. It doesn't have to be, I know for myself, competing in powerlifting, not everyone has to do powerlifting. Not everyone has to have, a barbell. Like using a trap bar is absolutely fine. But also, if you're just deadlifting with a kettlebell, that's okay as well. Like, strength is relative. Um, Quite a lot of topics and tangents thrown in there, Justin, but some really, really good content, some really, really good points in there. But the last question that I like to ask, and for everyone listening, what would be your take home points or words of wisdom from what we've chatted about today?
Oh, let's put it all in perspective. I think ultimately, like long-term health and wellness is not that hard. It might seem hard, but it's not really that hard. I mean, look at what the research has told us for a very long time on minimum physical activity requirements. 150 minutes a week. If you can move your body that much, if you eat adequate fruits and vegetables, if you don't smoke, and you maintain a normal body weight, if you can do those things, I know in the US you're in the top 7% for your health. So I think for a lot of people, like you and I could talk about the nuances of, well, should we contrast train? Should I deadlift from the floor? Like that doesn't matter for most people. Like most people just need to move their body. They need to find some sort of movement that's sustainable and dare I say fun, because exercise shouldn't be punishment. I like it for punishment for me, and maybe you do too. I enjoy, crushing the air down and laying on the floor for 5 minutes, feeling like I'm about to die. But I think for the general human, it's finding movement that is sustainable, doable, and fun, and realizing that it should be a big part of your life, but be it should be the same part of your life as like eating kind of 3 meals a day is. When you kind of find what you like doing, it now just becomes a little bit more of who you are and sustainable versus like, oh, I have to go exercise now. And like it's weird because I always tell people I've never not exercised. I've been kicking a soccer ball since I was 3 years old. Like, so I can't imagine what it might be like being unactive for 30 years and now having to do this. I'm sure it's very, very hard.
Yeah.
But what's the other option? If you ask every single person that listens to this podcast, every client of yours, every client's spouse or friends or family, if you ask them all, hey, when you're 60, 70, 80. Let's get some perspective. Would you like to be physically autonomous, live in your own house, be able to play with grandkids if you have them? No one's going to say no to that. So when you start thinking about the long-term progression, like everyone kind of comes to the self-actualization of like, oh, movement's important, right? I mean, you and I might talk now and you might be like, dude, I gotta meet in a year. I want to deadlift 600. Like that's the short-term goal. But ultimately, if you even think about yourself, it's like, what do you want to do when you're 60, 70, 80, 90? Because it's like you get one life. That's it. We got one shot, right? Um, and what does that look like for you? I've just found that those longer term conversations puts a lot more context and it gets people out of the right here, right now. And I think thinking a little bit, and then when we think big picture, we can now pull it down to like, well, here's what we're going to do now. Here's what we're going to do in 6 months. Here's what we're going to do. And then you show them the roadmap. But the first thing I like talking about is the destination.
Yeah.
Where do we want to get to? And then we can talk about the directions of how to get there. But that's the boring part. Like if you're going to, when you go to the UK, you're not thinking about your layover if there is one. You're thinking about, oh man, I'm going to the UK. It's the same idea. I think when we're trying to talk about people's health and wellness, show them the freaking vacation, show them the destination, and then show them how you're going to help them get there. So um, that would be my big takeaway.
Yeah, I thought that was a good summary of what we've spoken about there because I think sometimes people can be blinkered just on the. I actually thought you were going to go into like is it an Eminem song where it's like right here, right now? Oh no, it's not an Eminem song.
Yes,
Anyway,
I should have.
yeah, but it's kind of that thing of it's very just centered on like right now. And yeah, this is again how maybe my conversation have changed a little bit with the powerlifters that I train, the clients that I train with, who's like, yes, we don't want to do this at the sacrifice of all the other things that make us human and get to enjoy life. Like there's more to it, and not to be like kind of too woo woo, but it's to think about that bigger picture, and it comes back down to like what you said, there's a choice there, focusing on what you can do. Thanks a lot, Justin, for taking the time to jump on. Really, really enjoyed chatting with you today. If anyone has any questions about what we've spoken about today, want to reach out to you or see the content that you share, where could people find you or reach out to you?
Yeah, the best place is on Instagram. It's my name. It's at Dr. Dr. Justin Farnsworth. We have a website, drjustinfarnsworth.com. We do in-person education. If you've got actually anyone listening to this, a selfish plug, we'd love to take programming around pain international. I know you and I were talking about we have a couple international options that are hopefully happening, but I would love to bring it to more than just where we are in the continental United States. So people feel free. Instagram's a good spot. We have our website there. Those are the two best spots.
Awesome. Thanks again for taking the time to jump on. Like I say, I thought that was a really, really interesting chat. Thanks a lot to everyone listening, and I will catch you all at the next episode.